The McShin Foundation is Virginia's leading peer-to-peer recovery community organization. So if you or a loved one is struggling with addiction, let us get you connected. Build your self-esteem and lead you to a solid foundation in your recovery. Check us out.
Part of the reason why we started the HEART program was because in February of 2016, the sheriff came to me and said, Dr. Gay, do you know that in Chesterfield County, in the first 2 months, we had 50 overdoses and 10 deaths? And he came to me and he said, what are we seeing here at the jail? I said, sir, we are every day having 3, 4, 5 people who are being arrested and coming into the jail and having a heroin addiction, or opiates, or alcohol. But at the time, it was really high with heroin. And so I'm an internist, a hematology oncologist, but I am not an addiction specialist. But over the last 18 months, I've started to become one. So I'm going to take you through a little history so that you can get a little perspective on what it is that we're fighting. Well, first of all, what is heroin? Well, heroin is an opioid. It's derived from opium that comes from the poppy plant. But everybody knows, here's the word heroin, but I'm not so sure that everybody knows actually what heroin is. What heroin is morphine. That's all it is. It's morphine. When you take these two chemical groups, you do a little chemistry to it, and you change it to these acetyl groups that we call, that's why it's called diacetylmorphine, you get heroin. And why is that important? It's important because morphine by itself doesn't go into the brain as quickly without having changing those two groups. So once you change it to diacetylmorphine, then it takes 5 to 7 seconds for it to get into your brain. And it goes right through the blood-brain barrier. But once it gets into the brain and once it gets into the bloodstream, heroin changes into 6-monoacetylmorphine and morphine. So it is morphine that is doing all the damage that we're seeing today. And some of you may notice that this 6-monoacetylmorphine is also called 6-MAM. That's what we use to test the urine to see if somebody's using heroin. Bayer is the company that brought heroin to light. In 1897, scientist Felix Hoffman synthesized acetylsalicylic acid, which is aspirin. And then 2 weeks later, using the same process, he developed diacetylmorphine. The leader of the lab thought that the diacetylmorphine would be a better product, so they trademarked that as heroin in June of 1898, and then almost a year later, aspirin in 1899. The reason why heroin is called heroin is because the folks that they tested it on said that they felt heroish. And that's German for the word heroic, and that's where heroin came from. And as a company, they marketed all over the world. They sent samples to pharmacists, to physicians, all over the world. Here you have, they used it for cough. They made a cough medicine for children. And it was marketed for children. They had asthma pills that had heroin in it. They had liver pills that had asthma, that had heroin in it. And it was a really bad problem. Heroin was marketed by the company from 1898 until 1913 for about 15 years. And in 1913, they stopped. Why did they stop? Addiction. People were getting addicted. In around 1914, 1915, the population of the United States was about 100 million. There were 4 million people addicted. 4% of the population was addicted. And heroin was legal from 1898 to 1924 when it was made illegal. So 26 years, heroin was legal. Now, how does it work? Heroin works by getting into the brain and stimulating an area called the ventral tegmental area, the VTA. And this is the brain's natural reward system. When you see something pleasurable, when you eat something that you like, the body releases dopamine. That's your feel-good hormone, neurotransmitter. And so what happens is that the dopamine gets released and it goes to the different areas of the brain and you get your pleasurable experience. Normally, you have a little bit of release from dopamine if you see some food that you like or you're running, the runner's high that you get the release of dopamine. However, with heroin, you get an exaggerated release of heroin. And as this attaches to the dopamine receptors, you get an exaggerated response. And to illustrate this, here you have a normal response. You have the heroin attaching to the dopamine receptors, and you get a little feel good. You're good. When you're on drugs, you get a response, an elevated response, but your response is really good. And you might look like this guy. And that looks like me after I had red velvet cake. And after the drug, the body says, hey, there's too much dopamine here. So we're going to take away some of these receptors so that the response is not like this. And so as you see, after the drugs, you don't have as many receptors to have a response to. And what happens? You look like this guy. So here it shows that this is a chronic condition. There is a change in the brain. There's a change in the circuitry of the brain. So this is a chronic disease. It is not a moral failing. Here you see you have pictures of a normal brain, and the red and yellow spots are dopamine receptor availability. As you see, is a lot going on. But those with addicted brains, you don't see any of that. That shows that this is a medical problem. And because of that, because of the changes in the brain circuitry, your control center, in a non-addicted brain, you're able to control any stimulus that comes in, and you say, no, I don't think I'm going to do that because I could get in trouble, I can go to jail, I can do this, that, or other thing. But in addiction, your control center is disrupted, and the signal is inhibited. And that's why they have that constant urge to go. They don't think about what's going to happen, and it's really not a choice at that point. Not a choice at that point. Here's a quote from 1936. Drug addiction, like prostitution and like liquor, is not a police problem. It never has been and never can be solved by policemen. It is first and last a medical problem. And if there's a solution, it will be discovered not by policemen, but by scientific and competently trained medical experts whose sole objective will be the reduction and the possible eradication of this devastating appetite. There should be intelligent treatment of the incurables in outpatient clinics, hospitalization for those not too far gone to respond to the therapeutic measures, and application of the prophylactic principles which medicine applies to all scourges of mankind. This was August Vollmer, who was the first police chief in Berkeley, California. And this is 1936, so that's 81 years ago. You can't arrest your way out. 1936. Addiction is just like any other disease. It's preventable, it's treatable, it changes the biology of the body, and if untreated, it lasts a lifetime. Here you have a healthy brain and the metabolism that's going on. There's a lot of metabolism going on. A diseased brain of somebody addicted, a lot less activity. Just like somebody who has a healthy heart, a lot of metabolism, but if you have a diseased heart, there's less metabolism. It's a chronic disease. Drug addiction is a chronic illness with relapse rates similar to those of hypertension, diabetes, and asthma. Relapse rates for diabetes about 30 to 50%, hypertension and asthma about 50 to 70%. Drug addiction, 40 to 60%. What that means is that somebody who has hypertension, here they have a problem, they get treated, the severity of their disease is low, but something happens, they start to relapse. Where do they go? They go back to the doctor. Oh, I'm sorry. Okay, let's change your medicine. Let's change your therapy. Let's do something else. Addiction is the same pattern. But what happens? Oh my God, you can't stop? What's wrong with you? You shouldn't choose to do this. So there's a big discrepancy. And so we must reframe the stigma conversation. That addiction, we have to change that addiction is a moral failure and reframe it to say addiction is a chronic disease. When we do that, I think that's just one part of how we can help control the epidemic that we're in right now. There are chronic care models that are proven to help reduce the morbidity and mortality in patients who have other chronic diseases. And this is a comprehensive treatment plan for somebody who's in recovery, from mental health services, family services, housing, transportation, financial, everything is here, and it can be done. And it was reframed by Dr. Vivek Murthy, the 19th Surgeon General of the United States under President Obama, who sent a letter to all the physicians in the United States that said that addiction is a chronic brain disease, not a moral failing. Thank you.